in a community of support, bringing people together to live a lifestyle within business, within an industry, but an industry that was originally based around patients who were suffering. And that's the story we're going to hear about today from Maggie. Let's take a listen and hear her story.
How do you want to refer to me?
Well, I won't use your name, so I'll just patient, just Colorado patient.
Call me just a different name.
All right. What other name did you want to be?
Love a Pete.
When you were a kid, what other name did you wish you were?
George.
Do you have a middle name?
No.
You don't have a middle name?
No.
Margaret? Gertrude?
Maggie.
Maggie?
Maggie.
All right, Maggie. All right, fine. So when I do the show, I'll just present you as patient Maggie.
Doesn't anybody... I just want my Fourth Amendment right. My right to privacy.
Mm-hmm.
Bitchin'.
Well, how's your MS doing?
Well, I'm not on any pharmaceuticals.
Still?
Yep.
How long have you been off pharmaceuticals?
A month and a half. No, a year and a half. A year and a half.
A year and a half?
Last year is when I had all of that. Yeah, a year and a half.
What were you on?
Some MS medicine. I don't know. Gabamine, Avonac, Copaxone. Just different MS drugs.
And how long were you taking those for?
A couple years each time before I said enough was enough.
Wow. So, what are we in 2013, 14, 1998, 99, I guess?
Somewhere around there.
I don't know. I don't know math.
What?
Well, I just...
Well, it's very well managed.
I don't think about it that much other than when I talk to her because I don't know anybody else with it. So actually that's not true. Just a few months ago, an old professor from university I saw on Facebook said that she had it. Supposedly here in Colorado, there's a high percentage of
risk.
women. I don't know why. How are you diagnosed? You were feeling weak?
Numbness in my legs. After I got done swimming, I used to swim at Utah Park. That pool is extremely warm.
And then you went to...
Then I went to a doctor, and they took x-rays, and they didn't find anything. And then a year later, I went back and still said I had numbness. They did an MRI, and that's what showed that I had MS.
Wow. And then you started doing the injections in the legs, right?
No, I did first the Copaxone, where you did the arms. It was just underneath the skin.
But were you smoking at that time? Or did you start smoking because of it?
No, I had just smoked recreationally.
Beforehand, okay.
Yeah.
So you start taking those major injection pharmaceutical drugs, and they were like $1,000 an injection or something ridiculous like that. So you've trucked along well.
Well, I don't play the victim.
Meaning what? You could have done what?
Meaning that I could say, poor me, and have somebody else have to take care of me and not take care of my health and not do what I need to do to be productive.
Well, now you have Obamacare to keep you fully insured, and you don't have to worry
Well, you don't have to worry about pre-existing conditions.
Right.
But I wouldn't benefit from Obamacare.
Well, in the sense that you're not tied to your employer for insurance because you depend on insurance.
No, correct. But I still wouldn't be able to afford insurance on the secondary market.
But in your state, you're dependent on being employed with a corporation that has that type of insurance plan.
Right, yes.
You cannot venture off on the entrepreneurial path, and you can't go work for a small business.
Yeah, well, now I could, yes.
Right.
But,
well, that's what I mean there you go. That's how you could benefit from Obamacare. That's how everybody could benefit.
Well, I think just there's a lot of things that was all right.
Over the last 16 years, would you say your health has just stayed the same?
Yeah. If anything, I'm more in shape.
Because you're forced to exercise and eat right, and
I only drink water or juice.
Yeah.
And this is diet cranberry juice.
Oh, great. What does that mean? They've taken half the cran out, or what?
It's only 5 calories.
Are you a red card holder?
Yes.
Okay. Did you do it for MS?
Yes.
So you look at yourself as a stoner?
Yes. Well, I
but
do.
Were you before you were a patient?
No, I was a stoner before. No.
Before you were a patient?
Before I was a patient? Oh, absolutely. I've smoked for over half my life. I mean, if you think it, over 25 years.
Yeah.
That's a long time. So I'm a stoner, but I definitely see the benefits.
Of the medical part.
Of the medical part. I've not been on any kind of pharmaceutical for a year and a half. I am extremely stable. The last time I went to my neurologist, which was last September.
And then a neurologist is the doctor that tells you if you're neurotic?
Well, I am neurotic, but that's a whole nother subject. No, but he actually said he tested me for 6 other things because he said, I'm not so sure I had MS. And by that time, I had already been off the pharmaceuticals.
How could you not be sure? Isn't it lesions on the spine or
well,
something like that?
Well, he just thought that I was doing so well that it could have been misdiagnosed. So he ordered tests.
But this was after you were first diagnosed or during the initial...
Oh, no, this was way after. This was just last year. This neurologist wasn't so sure.
What?
I'm just telling you. And then when we were done and he looked at all the tests, he said, for having MS, he goes, you've got the mildest case I've seen.
What was it originally diagnosed as? Was it originally a grave case?
There are different types. Again, I think my mental attitude towards it,
right,
that I'm not going to play the victim.
You should write a book. You could travel with Tony Robbins.
I just try. You live a good life. You do what's right. You know, you don't sweat the small stuff because really, you know, we all have adversity in our life. It's like, who cares? Just get over yourself and just do what you have to do to make yourself productive and happy.
Well, I don't doubt that mental attitude definitely affects our life.
But I do also think, that the medical part of my smoking marijuana, I don't think that hurt. The pharmaceuticals, every time I would go on, after about a year or so, I'd have more side effects than I did before. So it's like, why even bother?
Well, those were some pretty heavy-duty drugs that were pumping some pretty toxic chemicals through your body.
Well, I'm sure they were. They're all synthetic.
Yeah. I mean, there's nothing in marijuana that's artificially placed there or toxic. So over the last 16 years, you've progressively gotten better? Is that what is? Or you just all of a sudden after 16 years?
No, I think I've progressively. I've learned how to deal with it. I've learned my limitations.
Because you weren't MS to the point of being wheelchair-bound,
no,
incapacitated by any mobile
No, but
means.
I haven't lost my eyesight, and that's very common for MS
Losing
patients.
eyesight?
Yes.
And the
that's
ability to walk,
regardless
right?
of how bad. I've had days where I've limped, I've been gimpy. Well, I have, and where I've had to stand up against a wall just for balance.
And how long have you been frumpy?
It's part of the Seven Dwarfs. They got rid of me. So no, last year, I had such a bad reaction to the last drug I was on. The neurologist placed me on steroids. I was on them for 6 weeks. What is the one?
And did it work? Did it make you... whatever?
No, it was even worse.
Really? Wow.
5 of those days, they had to give me intravenous, 1,000 milligrams
of steroid
into my arm and through my vein because of the reaction I had to the drug, to the synthetic.
You've had bad reactions before. Your Zoloft reaction was...
Well, that's why I would prefer to medicate myself with a more natural substance.
You know, I wrote a whole paper in my master's program based on the Zoloft. One of my classes, I had to write a paper researching a company and its marketing. And I wrote this paper based on Pfizer and Zoloft and what they did with their PR and marketing and that, and then how they transitioned that drug onto the generic market. Very interesting research in that. A lot of people died, suicides, and, you know, the drug reacted very negatively with many people. So you can be lucky that you got through that one. You've shed all those other drugs. You just smoke now.
Yes.
You don't do cigarettes?
No.
No alcohol?
Occasional.
And then,
that's not the norm.
And how much are you smoking?
A couple bowls a day. So not a lot to maintain.
But are you talking about these bong bowls here?
Yes.
So not a couple bowls like this tiny little pipe sitting here, but you're talking about...
It's not that much. It really isn't. I don't fill it all the way up. You did.
Oh.
I don't...
Do you have lung problems?
No, I swim a mile twice a week.
A mile?
So I exercise frequently, yes.
Is that like a feet? I don't know. Is that...
A mile.
I can walk a mile in about 15 minutes.
Trust me, you look at markers. A mile is a lot longer than you
Like
think.
you're talking about just nonstop?
Yes.
Oh, okay. Well, nonstop swimming, yeah, that's true. I wouldn't jog a mile nonstop. I can jog a mile in maybe 10 minutes.
So I do the elliptical machine when I can't walk the dog the other days.
Oh, that's your mile on a machine?
No, that's a supplement. So when I don't go swimming, I do other exercise.
Oh, all right. Well.
So no, I don't seem to think that I have lung problems.
All right. Well, I don't want to talk about your exercise routine. On
You asked.
Now I'm going to have to cut all that out. I'm going to have to listen to it twice now just to cut it out. Tell me about how smoking makes you feel, over the years, because you smoke now without the drugs. You smoked when you were using the drugs. What were the differences of how it affected you, how it made you feel? Did it make you feel better? Did it help relieve the side effects of the other drugs?
No.
It never relieved side effects?
Well, it might have put me to sleep.
So what does it do then when you smoke?
For me now?
Yeah.
I don't know if it's more of a mental state.
Like it puts you in a relaxed mental
Just
state?
in a relaxing mode. It takes the edge off. It takes the stress off.
So you can watch meaningless TV and then...
No, I don't watch a lot of TV.
So what do you do? Does it make you creative? Does it just make you sleepy?
Makes me clean.
Really? Interesting.
I like to iron, so I'll stand.
Like as a hobby?
I'll iron for 3-4 hours at a time.
And you find enjoyment in this?
Yeah.
And then cleaning?
Yeah. I mean, I was going to vacuum and stuff, but this evening, I don't mind. Trust me. This isn't bad.
What is this considered? Is this considered clean?
Lived in.
This is lived in.
Yeah, I wouldn't say it was
So you
clean.
do all the cleaning?
I do most of the cleaning.
How does it make you feel when you're suffering your symptoms? And when what are the symptoms of MS? Is there episodes?
Sometimes I have a twitchy leg. Well, that's not funny.
No, I'm not.
Leg is not. Bill Maher says different. He's never had a twitchy leg. Oh, it's miserable.
What?
Bill Maher, when he goes on his pharmaceutical kick, he'll make fun of people with restless leg syndrome.
So you have restless leg syndrome?
Yes.
And that's the symptom of MS?
Yes, it can be correlated together.
But
the nerve, it's a nerve that's out of kind of control. It's a nerve thing.
So your nerve has lesions on it?
No, the spine has lesions.
The spine
on
has
it.
lesions. And do
It's
they
just
get
the
inflamed
nerve
or what?
cells.
What's the? But it
they get blocked.
Is
from
it just a
getting the
constant
figure.
state of MS, or is there episodes
There
where
are
you're up and
episodes.
down?
There are episodes.
Like I'm more MS today.
Yeah, it depends. Weather is a big factor.
Oh.
The hotter it is, the worse it is.
So when you say you have your red card for MS, what is the doctor actually recommending that this is going to do? Help you do what with MS? Is there like less? Is there pain involved with MS?
There can be.
What type of pain?
Well, your leg pain. If I went blind, that would be a stress. And that would be a very unnecessary stress. That would be horrible. That's very, very common.
Going
with
blind.
MS.
It has something to do with the rupturing of the
optic nerves.
It's
they
like
get blocked.
in diabetes, the eyes get under so much pressure they explode. Well, I'm simply trying to get an answer to what. When you say you have a recommendation, a red card recommendation for medical marijuana for MS, what does that actually mean? Like, what is the symptom that the marijuana is helping you overcome?
Maybe it works so well
Is it
I don't
pain?
have any symptoms.
So
Maybe
what's
I'm
the recommendation for? What doctor did you see?
No, I honestly don't know how to answer the question. I really don't.
So you just walked into the doctor and said, "Hey, I have MS."
Said, "Hey, I have MS."
And he was like,
it's a regular.
"Good enough for me."
No, it's the first doctor, but now I go to a real doctor that.
You exploited the system. You did exactly what you said you didn't want to do. You used MS to get a license to smoke weed when you don't even know.
What did you do?
I'm in severe pain.
If you could just. Oh, bullshit. If your body went through spasms just because.
So it helps relieve spasms.
Yes.
Well, I don't know. I'm not the patient. You're the patient. I'm trying to get that information. Oh, well, next time somebody asks you, tell them it helps relieve spasms that are caused by MS.
Spasms,
Tell them MS causes spasms and smoking helps relax those spasms.
I think it relieves a lot of stress.
Yeah, in general, everybody knows that. But in Colorado, to get the medical license, it was supposed to fall into the category of...
I have MS. I'm not 34 years old saying, "Oh, my back hurts."
No, you were 34 when you were diagnosed. You just said.
Yeah, I didn't get my red card until...
Yeah, but you were basically my age when you found this out.
Yeah.
That would be the equivalent of me right now discovering something disabling.
Could have been.
I mean,
no, it was because I couldn't get out of the pool.
I don't know if it's considered a terminal disease. It is? MS is considered a terminal disease.
I am.
People are like dying from MS?
Yes, if you have the real severe type, yes.
Like one day you're just like, oh, I'm checking out.
Yes.
MS got
Actually,
me.
there was a special on with Dr. Kevorkian, and his first patient that they were doing the documentary on, it was an MS patient. I'm like,
well, that's how this all started. The medical, I mean,